I mean,
This is sufficient.
I only take hard copy x-rays because people say you should take them for pathology.
But you still recommend a table for, you still recommend a table?
You mean without, if you don't have nothing?
No, if we have a visualizer, and you still recommend on the first
Oh,
patient,
yeah, I
you take
still
it for pathology.
Then you have the records. See, because insurance companies don't pay for video. Most of them don't, because chiropractors ruin that too. When I was the only guy that had one, and for 2 years I was the only guy that had one, I turned in $100 for every time I did it, per person, one time per person. It wasn't one insurance company that turned me down. And you know, that added $100 to my pocket for every new patient. I just upped everything $100. Now you figure that year I started 2,550 new patients. You multiply that by $100 and you'll find out I made a few bucks, like $255,000 extra. Just with a lousy 100? No, most people don't start that many new patients, but let's say you started 500 new patients a year at 100 each. That's $50,000. But let's say you only started 100 at $100 a piece. That's $10,000. That would pay your payment. Thank you. Like, how long have you been in practice?
7 weeks.
Oh, 7 weeks. Oh, you're with Pittston. You already got a visualizer. How long have you been in practice? If I was him, I would go back. You know, if he didn't have the money, I'm just saying. If he'd say to me, how would I get this? I'd go home and I'd pick 100 of the people who really liked him. Now, if he don't have 100 people that likes him after 10 years, then he should go right down to the riverbank, buy a new pair of shoes. I have a store down there on the riverbank. They're lead boots. And you buy a pair, and then you try to walk across the river where there's no bridge. See? Because you're worthless. If you don't have 100 people that likes you in 10 years, something wrong with you. And you say to them, look, I found something new that's going to help you get well faster. Do you think you could see possible to give me $200? You give me $200, I will give your family until they're grown up. Now, you know, we want to watch how you say this. X-rays anytime they need them for no more cost. The rest of the time I'm in practice. Now, once they get married and stuff, it's a different problem. But for you and your wife, that means forever. Could you give me $200? So you get 100 people, give you $200, you have $20,000. That's enough to pay the first 20 months' payments on your visualizer. If you can't make it after that, then by God. But there's no reason why anyone who's been in practice should have one of these. Now, when you see me do this, then you see something else. So, who was the first person? Somebody give him a reading. Yep. Who wants to give, which one of my great helpers here is going to give a dermathermograph reading to this man? First, we're not going to be able to plug him into that one. We're going to have to plug him into, yeah, we don't need that anymore. Oh, we need to plug this in.
Yeah. You know what I'm going to do with this cord.
No, we don't want that cord.
You know why there's that orange cord in the back of the room?
That has a three-way on it.
My cord.
Donate your cord? Oh, you're using it. You know, you might be able to trade them with that, because they have a,
You got it all?
yes, we got it.
Doc, you didn't need the table? We'll get the table tomorrow. I'll just do the cervicals.
Just the main benefit to you guys that have been practice for a while. I got my visualizer, I paid for the next 5 months payments in the first month. So I did miss one payment though, and I just forgot to pay it. Caught up with that immediately. And it was after a couple of years.
How long have you had your visualizer now, Kenny?
3 years.
3 years? If I was only one visualizer in the world, you couldn't buy it away from me for $1 million. For what it's done for my own family. Everything is relative with that. Right on the vertebra. Okay, I'm picking C5 because I have a C5 there. This is a C5. I'm going to go for C5. I'm going to adjust it to 30 pounds, 35 pounds. And you'll know when to shut off.
What is this measuring?
Whenever I'm adjusting patient, I don't answer questions because I have to concentrate on them. Feel that in your fingers? Now, I normally would have a tabler and we go through dorsal and lumbars. I'll do that tomorrow. And we'll go back and we'll recheck these. Now, I should give it more time in between to give it a chance to adapt to what I did. See, but by the time I go through lumbars and dorsals, that's enough time. But we brought up his atlas, we brought up his third, we brought up his fourth. Fifth stayed just about where it was. I'm happy with that. We made a nice change. The next time I check him, I might want to do 6 and 4, which are the mates. But there's no way I go back after 5th day. I'm happy with the changes we made. We brought up the one above it, which means this subluxation here is definitely changed, and it even affected third, so it even went up and affected the atlas slump.
Now, if you would come in next week and you think about going back to C5,
I have no idea what I did. I have no idea. I would wait and see what I had that day.
Can I ask you, what are you measuring this?
Force versus resistance. The resistance of his vertebra versus the force I'm putting into it. This lets me know what's moving and what's not moving. I want all these things to be up to 10 by the time I'm done. Who's next?
You have a heavy screen on the screen. Ask me which one I want, and I will
Do what the one I have.
I know.
Well, she sent both of them.
So you already bought one?
Yeah, I don't have the graphic yet, but it was ordered at the same time, but it's not.
What, that?
Yeah. I was gonna call today and see.
And you already ordered one of these too? Now what was your,
No, I didn't have the computer.
what was your, oh, you just got it.
You said to adjust C7 from the left, Q2 on the right.
Yeah, what else?
Well, some options.
I see one of other law.
Oxford
Oxford,
C1,
one lock
and then
selection,
C6 through T3 is the total.
C6, C7 lock, lockdown extension, need to do C7 from the left, T1, T2 star, need adjustment on the
You're
right.
my listings for you.
Well, she was reading them there.
I know, but you really want me to do down, I'm going to 6 first. I won't pick up that. Yeah, I picked 6, and between 5 and 6 shows our biggest drop. You feel that in your fingers?
I do.
13. 13 hits. And see, we can do the dorsal setting up. You know, he has all kind of low ones in here. What I normally try to do is get the cervicals and the sacrum up. Then if the dorsals and lumbar stay down, then I'll go after them next. But I try to level the 2 areas that's most important to me first. Sometimes when you do this with as many different listings as he has, is I do one, a lot of the other ones might come down. And then I go after some of them. Now see, we brought up 7, which was one I picked to do. Second dorsal was a real bad one on him, I said. It come down. And 5 went up. See, I did 6. It basically went down, but 7th went up, and 5th went up. So I'm happy with that. But since his second dorsal is so bad, I'll go after it. You have to learn how to palpate all over. Sometimes you end up with more burden than you should have. Especially if someone's talking to you, or you end up and you have less vertebra than you should have.
I thought this one should be on the right, but
No. Didn't I say second dorsal on the left?
Right.
Did I say right? Hey, if you don't know your listings, I stand there at home, I can't remember. Don't wait till I'm done adjusted, it does say it should have been over there. But it should have, it didn't move either way. But I picked one side over the other one, and we'll see what happened. Let's go down here and see if we made any changes in the dorsal down here. See, they're more balanced now. So what we like to see them do is balance and then come up, but they also came up, just from adjusting up in there. Now we'll go back up here and see what happened here.
I think you got results because the whole thing was fine.
Yeah, because, you don't have to go down in the dorsal vertebra to make them change. I can do that from the pelvis. I can do it from the cervical. Okay. Now they're all down. This one came up more. This one came up. This one came down. But I would quit for the day. Okay. Second dorsal. But the next time we'll make sure that he remembers his listing so I can.
well, I remembered it all right. She was reading my notes.
But I'm up here pounding, and it's over, and you say, I think it should be on the right.
Well, I don't know what you're doing. I've never been exposed to this technique
Yeah, but-
before.
See, this is the left. This is the right. But we didn't kill you. You'll live. Because make some nice changes down here. Who's next?
Here, I need a table for plan 7-1 extension. Don't you?
I am doing this.
Okay.
Now, what did I want on you? Occiput, atlas, what?
C1 inflection, I don't know if you said occiput or not. We've been adjusting it. Inflection.
Oh, what did you write down when I said I was what?
I wrote C1 inflection and C7 one extension. And then there was a couple of rotational with C7 on the left, 1 and 2 from the left.
No. That would have been it. It might have been C7 from the left. And first and second on the left.
First and second on the left,
Yeah.
C7 from the left.
Yeah. I know how I say it. This was for the atlas. You know, Mark first worked when I went to do the atlas too. Because you do the atlas, I'm doing the first portion of it. Now remember them listings and remember what I adjusted today. Because what I adjust today, I usually won't adjust tomorrow. Did any of you guys feel that in your fingers? Or them guys I adjusted? Did you feel that in your fingers? See, I'm not always pleased with them when they do this, but I'd rather see them balanced. And a lot of times they start creeping up after they're balanced. But one thing I'm not doing is giving enough time. I usually do dorsals and sacrum, then adjust whatever I find down there, and then I come back to this. But see, here we don't have the tables, we don't have nothing. See, the way this is set up, I'm using the same disc for everybody. Because I can do that with this. It saves me a lot of time. But in my office, every patient has their own disc, so that whenever they call for some records, I can throw it in there. And then I can print. And it tells them exactly what I adjusted, how many times they was hit, and everything. Okay, who else? Okay.
You still do occiput C2 one here?
I always do occiput and C1 by hand. C2 I never do by hand. I do T1, what I
C1.
T1 I always do by hand. Occiput and T1 will I do by hand. Now see, she had one of the better necks of the bunch, and she had one of the better readings of the bunch. And I think I picked 4 on her to adjust. But I'll tell you what I'll do. I'm going to do 5 because it's lowest on here, and the subluxation's in that area. And this feels that I'd be better off doing 5. And since I'm right in the area, and 4 will affect 5, I have no problem taking it that way. Back to vertebra. You feel it in your fingers?
No.
Did it hurt? Okay. No, it only took 7 times. And that's about what you would expect. Because she just don't have a lot up there today. But you know, tomorrow, she might have a ton. I think that there's evening person, there's morning persons, or afternoon one. She might be better off adjusting in the morning. You might be better off adjusting in the afternoon. You might be better off adjusting in the evening. see on her we did, right? Everything came up. See, the two, the dorsals came off, the occipital come off, everything. This from those 7 little taps. And hardly any weight in between. But she had one of our better. Now we have a bad neck. Where's old bad neck Ursula at? Here's old bad neck Ursula.
Like with the woman she did, it's like that.
Ursula, where did you get all these stickers? It's been all yours, Ursula. Are you full? Huh? What do you have? Yeah, but I told you it was as bad today as it was last time. What I take this time?
Good. Atlas, occiput, C3, C6, C7 on the left, and dorsal on the left, 1, 2, and 3.
Okay.
No.
See her, I did C3 last time. C4 is down this time. I'm gonna go after 4. Yeah, I remember you had a bad C3. Yeah. You know, when I used to do PIs all the time, I had a shirt that said, Dr. Pierce makes big holes small. Operators are what we were talking about. I'll tell you, Lori.
See? Not me.
That's right. It's her, Rich. We know now. We know the truth. The truth is that she's been working with Buell and Nooch just too long. Next thing I know, she'll be going in restaurants, asking people for patients. Look how nice we brought up C4. And that's really good when you can change in that fat, but see, you've been adjusted before, starting to respond. How do you feel after we did that for cervical?
No, last time. I felt great. Yeah. That was the first time in years I didn't have menstrual cramps the next time.
Now we'll do everybody else again tomorrow. And some of you kids can go down, who's had a lot of seminars and went on doing this stuff, you can go down and get and that's some piece of equipment. And we barely scratched the surface on that. We've got so much work to do on that. That's where you start. That's all.
We're gonna meet here tomorrow and meet here at 8?
8 o'clock. 8 o'clock.
Laura? Yeah.
As we did, there was no lumbar body rotation. Then we come up against one like this, and we adjusted on the EX side. And if we adjust here on the EX side, what are we going to do with that rotation? We're going to make it worse. So after we made a couple people worse, you know, here's one adjustment's working great. The very next patient you get, you adjust them, and they go, it just totally reversed the condition. The ones that were getting worse had lumbar body rotation. So we changed the rule, and instead of saying adjust on the side of EX, we said adjust on the side of EX as long as there's no lumbar body rotation. If there's lumbar body rotation, you change your adjustment and adjust on the side of lumbar body rotation. Instead of saying adjust on the side of IN, because this would confuse you. So we kept the adjustment to the sacrum. So you adjust the sacrum on the side of EX as long as there's no lumbar body rotation. If there's lumbar body rotation, you will look to the side of lumbar body rotation. Okay, you can turn lights off. Now here's a real INEX, at least that's what it appears to be. Now in this patient's history, there was a history of multiple double lumbar rolls. Now, whenever you see a short leg on one side and the bodies are rotating the other side, this is out of compensation, because the rule says the major pelvic listing should be on the side of short leg. Sacrum base inferiority, you have these notes in your new notes. Your sacrum base inferiority should be on the side of the short leg. And your lumbar body rotation should be on the side of the short leg. Well, here we have a short leg. It's about 1/4 of an inch shorter than the other one. But yet the lumbar body rotation is the opposite. So the first thing you have to do is you must get rid of what came last. So if what came last was a maladjustment by a chiropractor, you have to try to correct what he did. So you would adjust here. And when we did that, all the lumbar body rotation came out. We still have a short leg here. Look how much the tailbone has moved over. This black line pretty much represents your tailbone. It moved over a whole inch. So then we have to reanalyze this picture, and the only thing we have here is we have a less of a pelvic opening here than we do here. We have a bigger obturator up and down than we do here. So what do we have, Laura? We have a PI on the right. And then, now we're back to the original subluxation. This is what the guy looked like before the other chiropractor got him. So you adjust the PI on the right, and you're home free.
The first adjustment was at the social base
On the left side. Take out what the chiropractor brought in. Here's an INEX. Okay. Now, one thing you gotta look at is the lumbar vertebra that controls your sacral adjustment is the 5th lumbar. See? Now, you have to worry, does this patient have a bent spinous, or what does he have? And if you look up here at this black opening, the top of the spinous is right in the center, but the bottom of the spinous is way over here. So what you have here is you have a bent spinous. And that gives you the appearance that that patient is rotated down in there. And there could be a little bit of malformation in here. Now this patient was actually adjusted on this side, and in 4 days those obturators were perfectly normal, and the tailbone was in alignment. This patient was x-rayed 5 years after this, and the pelvis was still exactly the same. Now here's a very fresh pelvic listing. This pelvic listing is only 5 days old. Now this girl had slid into second base, and she went totally paralyzed. And she was put in the hospital, and they wanted to do surgery on her, and her mother and dad said no. So she stayed in the hospital from Wednesday to Monday, and by that time she was able to get up and maneuver on crutches in severe pain. And they brought her into our office. Now she has no lumbar body rotation. Now a lot of people look over here and want to do a PI. But this is the short leg. So this cannot be PI, even though it's open up and down, her normal is open up and down pretty much. Her problem is the width here. We adjusted that sacrum right here, took the pain away, and in 3 days her pelvis was back and the alternators were the same. One adjustment, 3 days, and no surgery. This is a fantastic adjustment. Here's my daughter after 18 years of my chiropractic care. You know, and when you have your own family with backs like that, then you're out there telling people that you know how to correct backs. Like if you take an x-ray of me in front of people, you'll find out that I have a good spine. And your kids certainly should have a good spine. Well, mine did. This is the same daughter that had that reverse curve. Now look at this. Now she has a little bit of a malformation here. This artery here is almost closed shut. This picture is in this book. And you can see how closed shut this hole is. This one is 3 times the size of this one. Now we adjusted her on the EX side, right here, and this pelvis was 1 week later. Now it took 4 months for her lumbars to get this straight, without any additional adjusting. Now, her lumbars just rolled around. That's why today, when I'm using this new instrument, you don't see me panic about lumbar readings being low. Lumbar readings will be some of the lowest readings you get on this instrument. You'll see me do very little lumbar adjusting because I'm working with the sacrum and the cervicals, using the same theory that I did before, that if you straighten the cervicals and the sacrum and the pelvis, your lumbars and dorsal will usually come around by themselves. Now, this was done in 1981. She has given birth to 5 babies since then, and her pelvis was x-rayed last summer, and it's still perfect from one adjustment. Now, see, I don't think there's anything that drove me more crazy than when I was doing cervical work for years and years and years and could never make a change. And then I come up with a couple crazy pelvic listings, and I could change spines. And some of the spines I adjusted 20 years ago are still perfect in the pelvis. Be that I was pounding the cervicals 2 and 3 times a week. It just didn't make sense to me. So, this is why all these things come by. Look at this person. And look how far that pelvis is off. 30 days later, the spine is straight up and down. I used to like it when I took full spine x-rays. I mean, there's nothing better for your ego than to be able to see that you can do stuff like that in 30 days. But of course, taking full spine x-rays is a lot of exposure that's unnecessary. So once I proved that I could do this, it was no longer needed. So now, of course, we only take 14 by 17s and 8 by 10s, and most of our work is done with the visualizer. Now, this is something that whenever I want to put up an AS pelvis for you, I have to search long and hard to find an AS pelvis. Of course, this is a football player. He was a tight end, and he jumped up for a pass, and someone came and speared him in the front. And he was carried off the field and was told he would never play another game. This is 11 days later, and he never missed a game. But look how much smaller the pelvic opening becomes and how the obturators get big. And that's what his full spine looked like. The other one is just a cut-off x-ray. Now here's a double AS that's in perfect compensation. This person here, when you see a pelvis like that where you can lay one half over the other half, I actually believe that where this comes from is in here we have some type of zygapophic malformation that gives you this. Usually this patient is totally free of pain. They have no history of any trauma. They just have this pelvis. Well, basically, I find out that you'd probably be better off leaving this totally alone, because I feel that there's a malformation in here, up in here somewhere, that this is going to let you do that. But see, when a person is perfectly balanced like this, and their cervicals and everything are good, the best thing you can do is stay away from there. Unless they have a lot of pain and have a history of an injury, then you go after it. You keep this in mind. What I show you as normal is only normal on about 80 or 90% of the patients. You're going to have people that's going to have large obturators, small obturators, all kinds of things. And this one we're about to show you is a person who really has very, very small obturators. Now, this person has really, you know what the listing on this pelvis is? You could get away and do the same thing that I did by adjusting here, by adjusting PI on this side. There's a lot of things that will correct the pelvis. And I lucked out on this one. I adjusted here, and let's see how the patient went. See? Balanced him right up. But look at the lumbar body rotation. What you guys do? Go out and get drunk last night?
We missed our wake-up call.
Missed your wake-up call. If you'd have went to bed at 8 o'clock, right after you studied your notes, you wouldn't have had no trouble. Yeah. Now you see how nice we balanced that person? Now right away, people want to look at these holes and say, well, isn't that AS? How do we know, Lori Pappas, that this is not AS?
Because of the pelvic floor. At the sacrum above the pubic sacrum.
And there's a elbow right there, and this is a nice heart-shaped pelvic opening. We don't have the hourglass effect here. All we have is small holes. But look at the lumbars, how they're all rotated now. Now that could be like my daughter and come out of there all by itself. See, once you balance the pelvis, then a lot of good things will happen to you. This was only 3 weeks. Now, if we'd wait maybe another month or two and take them x-rays. Now, the other thing we could possibly do here is we could do motion studies, and if these are not moving this way, which they're probably, see, they're already moved this way. So when you bend, they're gonna appear to move. But they've already moved. So it's almost useless to bend this person to the left, because the spinuses are already over there. All you're going to do is put a bend in them. So if they're not moving, they're not going to be moving this way. But you can't assume that and just start pounding on them, because they possibly could be moving. Many cases like this, after you level the pelvis, people, your job is over. Don't overdo. Don't try to mold the body. Just unlock it. Unlock it and let everything take its place. I'll never forget this case as long as I live. This is one of my pride and joys. This is what you call a spondylolisthesis, grade 110. Now, when you find a congenital abnormality like this, and see, I just can't believe the medical profession. This little girl had no trouble until she was 11 years old. And when she had her first period, she started having back trouble. And of course, they took her to the medical doctor and they found this. And them idiots wanted to do surgery. Or put her in a body brace for 7 years. So she took the body brace away. Because they said if they do surgery on her, she would only have a 50% chance of ever walking. Now, you know, here you are, you're walking, you've been walking for 11 years, you start having periods and you start having back trouble. Why does everything worse at the time when women are having them periods? Because this is a very, very weak time of the month. If you want to make them cry, all you got to do is say, boo. I mean, so any symptom that a person has is going to show up at that time. That's when they'll complain of headaches, they'll complain of this, they'll complain about that. So, these people don't assume stuff. They just right away want to go do surgery on this little girl. Now, she lived in a cast for 7 years from the time she was 11 to 18. Then she got married. She took the cast off. She still had the pain. She got married. She had 2 kids. Normal. The 3rd kid, when it was delivered, just about killed her. And from that time on, she became an invalid 80 to 90% of her time. She could do nothing. She could not take care of the kids. She could not take care of the house. She could not perform any wifely duties. Nothing. And on a Monday morning, she called me. Now, people say, why do you let everyone get through to you? Because secretaries can lose you more patients than anyone in the world because they don't know the right answers. This girl called. Number one, the only thing she had going for her, someone told her I was a good chiropractor and I could help her. So she got my secretaries know when a new patient calls that I can sell them over the phone because number one, I never talk money over the phone. You know, people say, well, how much does a doctor charge? Well, the first visit is $515. Now, how the hell would they know what the first visit was going to be? I don't even know what color this girl's hair is. See, I don't know if I have to dye it or not. But it's $515. Do you realize how stupid this sounds? You know, how would you like to call up a store and say, I want to buy a suit? Well, bring $515 with you. I want to buy a pair of shoes. Well, that's going to be $450. How do they know what shoes you want? Okay? And if this is somebody from an insurance company calling you, right away they know you're a fraud. Now you know, and I know, and you know, that we want to x-ray a person because we got to know what's wrong with you. But over the phone, how do you explain to somebody, well, I knew it was going to be $515. Why, doctor? Well, I routinely take this many x-rays on everybody. Well, see, that's how you get in trouble. So when a patient says to me, how much money is it? It's nothing until I accept you as a case. Or you accept me as your doctor. See, it always makes me laugh when I see free consultation. You know what that means? A person will talk to you. Isn't that wonderful? I'll talk to you and it won't cost you a nickel. See? Free consultation. Then when we get there, first question you ask is, give me your insurance cards. How much do they pay? Then we'll decide on what type of care you need. So over the phone, you never talk money. The only thing I'll say over the phone is, what is your office call? Well, my office call is $35. See? Tops. But that doesn't mean it'd be $35 for you. Because I don't know your circumstances. Come in here. Let me talk to you. Then you make up your mind, and I'll make up my mind if we have a marriage here. Otherwise, you go past your business and don't cost you a penny. So I got on the phone, and she said, Dr. Pierce, someone told me that you could probably help me. I go, oh, you talk to intelligent people. See, and I talk this way over the phone to people. I said, I probably can get you well. I said, because it sounds to me like you're a young female. That's 2 of the criteria you need. I only have 4 criteria you need to get well. If you're a female, you got 1 point up. If you're young, 2 points up. If you're good looking, you already got 3 points. You only need 1 more. See? What's the 4th one? Have you had an accident or something like that? Yes, I can get you well. I said, what's your problem? She said, well, I spend about a week, a month in the hospital. She said, I have a spondylolisthesis, and I've had it since I was 11 years old, and all this. And she said, I'm so afraid for you to touch it. Oh, I said, that's okay. I'm allergic to spondylose. I don't touch it. I said, why don't you just come over and let me see what the problem is? Well, when can I have an appointment? How fast do you drive? How far are you from the office? Get over here now. I want to see you. I want to get my hands on you. I want to get you well. So she's over in the office by 10:30. This is the first picture I look at. I always start out with the lateral lumbar. I measured the curve. The curve is a 22 and a half. What's the normal? 19 to 24. Can I make it any better than that? Absolutely. The fifth lumbar is totally off the sacrum. The only way I can get it up there is I got to get a jack under here. And after I jack it up this far, I tie a screw in here and put it on a crane and pull it back up. Or I could do it a different way. I could make the sacrum a little shorter and bring it down and set it under here someplace. So we know we can't do anything. So can I do anything with this? No. So let's just forget this. Your spine is perfect except for this. Okay, now here's the A to P. Now right away, people see those big holes, they want to do some double PIs. Can we lay one half of this pelvis over the other half? We certainly can, can't we? Is that tailbone in perfect alignment? Is these hips the same width? Is this the same height as that? Yes. Are these femur heads balanced? Is our sacrum level? Is our ilium level? The only thing we have wrong on this pelvis is we have a tailbone that hangs low, and we have two big ob craters, right? But we have about 8 points that are perfect. So what rules out? Who wins? The ball game is 8-2. Who won? The guy who got 2 runs, he won. He had a lot of runs that nobody knew about. I mean, like the chiropractor, the changes there, you just can't see them. They had the runs, but they didn't put them on the scoreboard. So can we do anything with this pelvis? No. State board question. What's this sign right here, Jesse Ross? Oh, isn't he smart? Okay. Are these lumbars in pretty good alignment considering everything? So we can't do nothing about this, can we? Then we go upstairs. Which is the gross area, people? Cervical is a gross area. Smorgasbord. Can we do something about that? You can bet we can. 2 hours from the time I spoke to this woman on the phone. 2 lousy hours. I adjusted her at 12:30 in the afternoon, and before that my hands was off the back of her neck. 18 years of misery was gone. Right out the window. 18 years of misery. Gone with one adjustment. And chiropractors don't want to learn how to do that. They stand there and say, Pierce, you're the biggest liar I ever met. I mean, I've been called a liar by chiropractic students at Palmer School. One guy stood up and he said, I just think you're a liar. Because he wanted to know how I could reverse a curve in 1 week without hurting the patient. And I said, I don't know. Well, I just think you're a liar. I don't think you ever done anything like that. And I don't argue with people like that. I said, okay, you just died. Anytime he put his hand up like that after that for a question, I never answered him because he was dead. I couldn't see him. Like ghost. Couldn't see him. Wouldn't talk to him no more. We adjusted that 5th cervical. And as of today, on January 9th of this year, that will be 8 years that I did that. And I talked to this woman, she's moved out of the area now, but every now and then I'll call her up just to see how she's doing. because she was my baby. She worked for me after that. This girl that could do nothing started wearing high heel shoes. She never wore high heel shoes in her life before. The only thing that you could tell on her after that was she had a little bit bigger rumble seat than most of them. Okay, that's the only thing you could tell. She did the twist, she danced, she did everything. She worked 40-hour week. They ended up finding one of those motels that have these special beds in it. There's some motels that people only stay an hour in. The sleep is so good. And she did all the making of them beds. Sometimes these beds turn over 8 times a night. You know, the guy in number 1, he stayed all night. What a man. Oh, he was by himself. He was a truck driver. But these other people, they come and go. They go in and sleep for an hour and they're gone. But they had that type of motel. And she did all the own laundry and everything, made all those beds, everything. And just doing wonderful. From 1/5 cervical adjustment. Now, of course, we took care after that, but her neck changed 7 millimeters immediately, 7 centimeters immediately. She went from a 21.5 to a 28.5 right away. Now, this girl moved right after this, and we got to see very little of her, but she has never had another pain. No, I don't know if that curve ever came back, totally, because I've never seen her for years. I've only talked to her on the phone. And I said, you ought to get down here someday. She said, oh, I'll do it, Dr. Pierce. I'll come down. I said, I just want to take an x-ray and see how everything's doing. But she's great from one adjustment. There's a double PI in perfect compensation with a 5th cervical subluxation. Now this is May 1st. Now look at this very closely. This is May 2nd. Look at the obturators, look at the pelvic opening. Same patient, 1 day later. But if you look at this pelvis now, this one's normal. What's this one? Just a minor amount of EX. See, a lot of times when you take out PIs and stuff like that, you might find a little rotation or something in there. But that little bit would come out all by itself usually. But that's how much we changed that pelvis with 1 cervical adjustment. This is the lifeline. This you should learn how to do. You should learn how to do this so you can tell your people what everything's all about. I wonder why this don't want to focus so good. I guess that's about as good as we can get it.
Screen.
Screen?
Yes, angled.
You're in Vegas. Okay. Now, if you use this, with your neurological deficit chart, you will have patients come back and listen to you. See, there was one thing that I had let people like Kenny Guzik down on. Kenny Guzik was so excited with what I did. He believed 100% in me. He would never think of taking practice building courses and stuff like that. He was only interested in getting sick people well. Well, when you get sick people well real fast, they're not with you long. And when they're not with you long, you don't make much money. So you have to have a turnover of a lot of new patients to run a type of practice like we like to do. But when you're first starting, it's hard for people to have the type of confidence in you when you're 24 years old that they do in me when I'm 60-some years old here. So you have to educate. You have to spend all your time educating people so that they can educate people to bring patients into your office. You know, when I go back to the Purist Clinic today, that when I walk in the waiting room, and I haven't worked there for 3 years, I still know most of the people because they were people that I sold on chiropractic, and they come in weekly or monthly or something just to get tuned up. And unreal. And I say to these guys, aren't you getting any new patients? How comes I still know everybody? Their new patients after I left probably fell to 1/4. I have never worked 1 month in my life that I didn't get 100 new patients. Now, until I came to Spartanburg here, we only get 30 or 40 a month here. But that's because I really don't want them. I do not want Medicare people and welfare people and people that want to be clipping insurances. So I just never tried to build a practice here. I'm trying to build a practice of just people from out of state. Wait till I start building a practice for Rob and them and show you how you build a practice. But do it with education. You have a person in your office, you educate them, just how sick they are. Now this chart takes you from birth to death. You should gain no more than 20 to 25 pounds when you're pregnant. You should not gain. This is right, this is wrong. You should not smoke cigarettes when you're pregnant. You should eat good food. You should exercise. You shouldn't drink alcohol. You certainly shouldn't take chocolate, and you should stay away from the pies, the cakes, and the chocolates. And when your baby's born, they should be born naturally. They should not be born breech or with forceps. And when they're little, you shouldn't be throwing them up in the air and catching them. And you should cuddle them. And when you cuddle them, you should support that neck. You shouldn't carry them with one hand and smoke with the other one and all of that. You should breastfeed a baby for at least 14 months. No less than 14 months. See? Because when you do, a baby gets an inborn immunity, and you will be surprised how healthy they are. And then when they start walking and stuff, and naturally they're going to fall, and there's nothing you can do about that. But they should play baseball and things like that versus football. And when you live a utopia life, you should learn how to live properly and all those things. The things down here cause subluxations. The things up there is how you live. And you should walk off into the sunshine somewhere between 90 and 120 years. You should walk off. It shouldn't be this way. People who do this crap are the ones that end up with hydrocephalic babies and people that are crippled and all that. In here we have a picture of all the type of spines, and up here we have a picture of all the type of necks. Now whenever we do a patient's history, then we can put them on here and show them where they are on the lifeline. Most people come into life and think that they're meant to die. No, you come into life and you're supposed to live, and then you fade away. But this shows 73.3 or 5 somewhere in that area. That's what the normal lifespan is today. Now, Lynette thought it was 70. It's 70